This podcast was created as a product of cooperation between native media from Pakistan and Radio Stara Carsija from Serbia within the project Local Voices Global Exchange, which is part of the initiative Transparency and Media Freedom, Crisis Resilience in the Pandemic. All views expressed in this media report are those of the author and do not necessarily reflect the views of Deutsche Welle.
Dear colleagues, good afternoon from the newsroom of the local Radio Stara Carsija from Serbia.
Hello and good afternoon from Pakistan Native Media.
Today in our joint podcast, we will talk about Covid-19, the current situation in Serbia and Pakistan, the consequences of this disease, but also about the most effective ways of fighting it. This podcast is a product of the Local Voices Global Exchange project, which is implemented by media from 3 countries in cooperation with the Deutsche Welle Academy, the Deutsche Welle Center for International Media Development, Training in Journalism and Knowledge Transfer.
Yeah, that's wonderful. And once again, we will thank you to give us the opportunity to share our experiences with you. And it was wonderful because, we had realized during the during this particular project, that there quite a few things are similar, both in Serbia and in Pakistan. In both countries, religious minorities, in Serbia, Roma Community, in Pakistan, Pakistani Dalits are the people who felt them that they're being left alone. And we have focused on their plight in this particular project.
Well, we have found a lot of similarities while working together, and that was one of the reasons why we got so excited in connecting our 2 medias. And in Serbia, we actually talked to 2 prominent interlocutors who are experts in their field. We were talking about Omicron, which is currently the dominant variant of COVID-19 in Pakistan and Serbia. So in Serbia, the largest number of infected in the past period reached as many as 20,000 people in one day. So this 20,000 people actually means a smaller city in Serbia. So please tell us, what is the situation in Pakistan on that issue? Are there many infected? Which variant of COVID is dominant? And are the infections with mild or severe symptoms?
Well, there are mixed reports on media, but apparently cases are going down. I mean, it's a good news. And Omicron, that variant is very common in Pakistan. And, some days back, last week, the numbers were quite high. The positive numbers were like in thousands. Now, it is getting lower and lower. That's a good sign. And
today, the rate is 2.5. Few days before, it was in double digits.
So the good thing is that things are getting better, slowly but surely.
Those are good news. Those are really, really good news. We talked with Dr. Predrag Delic, who is an epidemiologist, and he told us in an interview when we asked him what makes Omicron different from the previous forms of COVID, he said that the characteristic of the Omicron variant is the fact that the incubation period is greatly shortened. So he told us about the data of WHO, and according to some researchers in Serbia too, the incubation time for this variant of COVID is about 2.1 days. So this actually means that a person infected with Omicron is contagious 2 days before the onset of the symptoms and 3 days after the start. So according to some estimates, one infected person can infect 10 people, which really speaks in favor of the fact that we have had so many positive people in Serbia and in Pakistan on a daily basis. So it's good to say that the clinical picture is easier than it was with the previous variant, the Delta variant, because if we imagined a situation where we had so many infected people that needed hospital care, in Serbia, we would not have enough health capacity in the country for all those people. And the fact that many people have been vaccinated and the vaccines really protect against more severe forms of the disease. And this has shown with all the studies that we have in the world today. And another interlocutor of ours, Zoran Pavlovic, who is the coordinator for Roma issues in one of the largest cities in the country, we learned from him that the exact number of vaccinated Roma is unknown, but that the percentage of the vaccinated Roma people in Serbia is very similar to the percentage of vaccinated people in the general population. So what's the situation with the vaccination in Pakistan? What percentage of the general population has been vaccinated in your country? And do you maybe have any information about the vaccination of the Christian minority in Pakistan?
Well, it'll be very difficult for us to tell you the exact number, but we've been working in the field and visiting the Christian communities, and we have realized, sort of a survey was that they are most of them are also vaccinated because some of them work in public sector, and it's quite essential for them to get vaccinated. But the main part of that community, women, who stays at home, they don't expect them to go and vaccinate themselves because they don't have such obligations. They don't have to go out, and plus they don't have their national ID card. This is sort of something very essential to get vaccinated in Pakistan. So
even though if those women are working as a house help, they don't get vaccinated because they don't have CNIC.
This is the current situation in Pakistan.
And during all this pandemic, they got pregnant and gave birth, but they are not vaccinated.
So that's the invisibility problem that we discussed a lot, and that is something that we actually share. The Christian minority in Pakistan has pretty much the same problems here with the Roma community in Serbia. They're also, let's say, invisible to the system because they do not have their ID cards and they cannot get vaccinated because of that. In order to be practical, when we talked with our interlocutor, we mentioned this and we asked what are the best ways to protect ourselves from COVID. And he recommended that for now, it is best to carry out frequent disinfection, wearing protective masks. Those are all the things that we discussed since the beginning of the pandemic. But he really says it does reduce the possibility of the virus transmission. In Serbia, these protection measures are not respected enough, and that might be a reason why we have so many COVID positive people on a daily basis. I don't know if we have told you that, but mass gatherings are allowed in Serbia. And we all know that the possibility of transmitting the virus is extremely high. So to what extent are prevention measures respected in Pakistan?
Quite the same. And I don't know whether, public gatherings are legally allowed or not, but we haven't seen people following the SOPs. And particularly, there are two main reasons for that. Awareness level, as far as this pandemic is concerned, it's something not up to the mark. We went to the Christian community and we asked, particularly the women and young children, young adults actually, and some of the men. We asked them, do you know what is Corona, COVID-19? What is this? They hardly know. They just knew that it is sort of a disease. They've heard it on media, but most of them were not aware of its severity.
They don't even care about it.
They don't really care. Yeah, that is also one point. And the precautionary matters we talk about, hand sanitizers and masks, it's quite expensive. They don't have the resources to buy it. Most of them told us that they cannot even think about buying a hand sanitizer. It's so costly. So as Afshan said,
and the surgical mask, they have been using this cloth mask and washing those masks and reusing again and again.
Yeah, exactly. So the thing is, as Afshan very rightly pointed out, that in the end, they sort of, gave it up, and they believe that, it's their pure luck. If they survive, even if they get Corona pandemic, they hit by the virus, it's up to their luck. If they survive, that's all right. Main problem for them was, their economy, their financial situation, because of the lockdown and other stuff. They've been, redundant in this, pandemic times. So that was their major concern.
The unemployment.
So the economic problems and actually the unemployment makes these minority groups especially vulnerable to COVID, the Roma community also is one of the most vulnerable groups in Serbia. And because of the virus, their life has been affected pretty much in every segment with the newly established rules. The most difficult thing was to overcome that fear of the unknown and to get acquainted with the new methods of healthcare. And when we did an interview with Zoran Pavlovic, who is a coordinator for Roma issues in Serbia, he told us that the Roma people within their communities, there was a lot of fear and panic. But in Serbia, for example, some cities organized delivery of food and hygiene packages to Roma settlements. And it was really quite well implemented in some cities. And through the media, they tried to inform the Roma people about the importance of vaccination and the importance of collective immunity. And our Radio Stara Carsija actively took part in informing in minority languages. Were there any such organized actions for the Christian minority in Pakistan?
Yeah, that was one of the main questions in our survey when we, went to their places. We asked them, is government helpful or are
For groceries?
for groceries or any other relief packages? But almost all of them said that they haven't received any help from the government. They are not the beneficiaries of any project that is being started from the government, or so it's very difficult for them. They felt
alienated, and no one approached them during this pandemic.
It's actually really, really hard to hear that there are people on the margins that are forgotten pretty much.
That's according to them. So we have recorded their responses actually, and that's their statement. That's their own version about this entire situation.
And their condition, the entire domestic condition, tells the story.
What's the education part? What's going on with education in Serbia? All the kids went to online classes since the beginning of the pandemic. And if we say that our Roma minority members and Christian minority members are very economically vulnerable, and I think it's safe to say that in Serbia, but also in Pakistan, these children do not have the necessary equipment to attend online classes. For example, Roma people are the minority with the lowest level of education in Serbia, and COVID really further threatened that. So we talked with them, and the only support to the most vulnerable students of the Roma population were some pedagogical assistants, and they would go to Roma settlements, they would distribute learning material to children, and they were a very important link between the most vulnerable Roma families and schools. And what's happening with the education in Pakistan, and what has the pandemic changed for children in the Dalit community? So how has COVID affected Dalits' economic living conditions?
Yes, exactly. From the reports and the things that you have shared with us, if we compare the Roma community and the Dalits in Pakistan, I would say that the Dalit community is far more poorer in comparison with the Roma community. I mean, it's they are victimized by a systematic. I always say this that it's a system of subjugation, and they are slave of that system from last 4,000 years. So just forget about usage of internet or online classes, because most of their children, actually, they told us that they didn't have the money to pay their fees, and there were no schools
during these 2 years, almost 2 years.
So
because the main question is bread and butter.
Yeah, not
the education.
Not the education at all. So the main point is that yes, there is a little number of people, Dalit community in Pakistan, who can be considered in a lower middle class, but most of them are very, very poor in normal conditions. I mean, you forget about the pandemic. They cannot think about sending their kids to school. And just imagine that, if some of them were very hardly they were able to send their kids to school in these times, uh, schools are off, and there is no system of online education for Dalit students, Dalit children.
And the internet is
Is
not
it?
that much cheap for them to afford for an online education system.
And how was the situation before the pandemic? Because the pandemic obviously really worsened their living conditions in every possible way. So what was the situation with the education of those children before the pandemic, when their parents had work? So was it better? They could go to schools?
In Pakistan, generally, our education system is, there are recent reports telling us that millions of children in Pakistan are out of school. The number of out of school children in Pakistan is very high. I can give you the exact number also. But that was the situation before the pandemic.
And girls.
And only,
education?
yeah, and girls' education is even, it's
More
worse.
worse.
So I will once again say that if you just, try to realize the economic situation of the Dalit community in Pakistan, they are very, very poor. They hardly have any resources. They are only, so-called success if they can just, earn bread and butter for their family, for their children. So you can imagine that even, they were working in workshops. They're working in streets for, to earn their.
And the child labor thing.
So after the pandemic, situation was extremely bad for them.
When we talked with the epidemiologist, we asked him what's going to happen, and did we maybe in Serbia learn some lessons? And he said that in his opinion, we didn't really learn a lot of lessons. And at this point, after 2 years of pandemic, we have rejected all the good things we have adopted. In the beginning, we were all very cautious, wearing masks, but we all want this to end as soon as possible, of course. But the good part of that conversation, that will probably make us all happy, is that our interlocutor is still optimistic about how things will go on. And he told us, like, every virus, regarding of its etiology, at some point has to lead to its destruction. So this means that each virus must go into a seasonal form. And he thinks that is likely to be the fate of COVID, because the flu virus had the same fate. And the virus had been transmitted from animals to humans, just as COVID-19. So he pretty much assumed that COVID will exist every year and will be endemic in some parts. And he hopes that this will happen soon, because there is a large number of people infected with Omicron. Then we have people who have already recovered from COVID, and then we have the vaccinated people. So all of this must provide like a little immune wall that will protect us against the breaches of the virus. So what do your experts see in the continuation of the pandemic?
Well, when the pandemic started, our Prime Minister stated that we should adopt the policy of herd immunity. So right from the very beginning, we were very clear that everybody will get the virus, and in the end, will develop herd immunity. So yeah, things are quite the same in Pakistan, and we also think that this will eventually become a matter of routine, just like the flu virus. But the most important thing I want to relate this with the Christian community is that I don't know what is the situation in Serbia regarding the minorities there, but in Pakistan, Dalit communities are not allowed to sit with the common people. They are being discriminated, and they're not allowed to eat food, use the same yeah. So now this pandemic have just given us, or the whole society, a reason, that a justification that this discrimination will get even worse. So I mean, we need to advocate. I mean, we need to say it loud on media that it's a virus. If everyone gets the virus, Christian community is the same.
We need to paint the image of our minorities to the general population in order to fight that discrimination that they are facing in their everyday lives and the discrimination that has been going on for centuries. So it's a very deep social problem, and we are tackling it, but we really must prevail because it is really, really important for all the people in the world to share the same rights. Dear colleagues, this would be the end of our meeting today. We hope that we have brought you closer to the situation in Serbia and Pakistan when it comes to COVID-19. And I hope that the opinions and advice of our experts will be useful to you in Pakistan. So thank you so much, dear colleagues, and see you next time.
Thank you, Muna.